Hello and good afternoon, everyone. Thank you for joining us. My name is Jessica Zavala, and I have the pleasure of welcoming you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar. Before introducing our presenter today, I do have a few announcements to share. I'll also mention that today's webinar will be in a different format. We're going to try to really have an interactive discussion about the new suicide prevention plan for Ohio and really the role that Ohio's colleges and universities will have within this plan. And really, while we're on the subject, I think it's also important to reference Ohio House Bill 28 as a resource. If you're not familiar with Ohio House Bill 28, it was signed into law in 2015. And really what Ohio House Bill 28 did was it required public higher education institutions to develop and implement a policy to advise students and staff on suicide prevention programs. And included within that is, for example, crisis intervention access. And so that access may include national, state, and some local hotline access. Also mental health program access. And so there may be information on availability of local mental health clinics, maybe student and counseling services, and certainly programs that may be available on campus, and outside of campus, as well as multimedia application access. So there may be some smartphone applications that maybe your university or others have developed. As well as student communication plans, so outreach plans regarding suicide awareness and prevention materials, as well as postvention plans, which we know as strategic plans to effectively communicate to students, parents, and staff after a loss. And so all those are included within Ohio House Bill 28, which Austin may briefly touch on in today's presentation. And now I'd like to introduce our presenter for today, Austin Lucas. Austin serves as the Program Director, managing suicide prevention programming, training, events, education, and resources through a 5-year SAMHSA Garrett Lee Smith Youth Suicide Prevention Grant and 3-year SAMHSA Mental Health Awareness Training Service Member and Veteran Grant. He works with community partners across Ohio, including local suicide prevention coalitions, government agencies, local outreach to suicide survivors, which is lost teens, mental health organizations, and many others to empower them and their communities to embrace suicide prevention training and build knowledge and skills. His passion for suicide prevention comes from his personal struggles with depression, as well as having friends and family members who live with mental illness. Austin is a certified Question, Persuade, and Refer, or QPR, and Work in Minds instructor, and he earned his bachelor's degree in psychology from The Ohio State University. So without further ado, we welcome Austin Lucas as our presenter for today. Austin, take it away.
Thank you, Jessica, and thank you for that introduction. It's always awkward to hear somebody else read your bio, but thank you. Again, welcome everybody to today's webinar. Again, as Jessica indicated, we want to make it as interactive as possible. I know it's not the same as the meeting format in Zoom, but please, I encourage you to type in the chat box if you have any questions or anything to add. And myself and Jessica will be monitoring that chat box throughout the presentation, and we will address any questions as they come up. And of course, at the end, there will be an opportunity for Q&A as well. But today's webinar is focusing in on the Ohio Suicide Prevention Foundation. Specifically, what are those resources that we offer to higher education institutions across Ohio, but also how can you play a role in suicide prevention as well on your campus for your students and for faculty and staff as well. And we will also kind of go into that state suicide prevention plan that Governor DeWine has embraced and released in a press conference back in February of this year. It's a 3-year plan, and we're going to talk about how you all can play a role in implementing that 3-year plan. Just a quick agenda, an overview of what we're going to talk about today. Again, I'll talk a little bit about the Ohio Suicide Prevention Foundation, who we are, what we do, who we serve, and then we'll get into the suicide prevention plan for Ohio that I just mentioned. We'll talk about the background, how was that plan actually developed, and what are the elements of that plan, those key elements. We're not going to go into all of the elements. I could be talking all day about it. It's a pretty large plan. But specifically, we're going to hyper focus in on how college campuses can actually play a role in implementation, because higher ed is a system that we have identified in our state plan that we want to make an impact on. And again, we have outlined specific steps of how higher ed institutions can play a role in implementing. And then I want to talk about some of the other resources that OSPF offers to higher ed institutions. Specifically, we have funded the development of an interprofessional suicide prevention course. It's a semester-long course that we've actually funded. I won't give all the details out now. I'll wait till we get to that. But that's very exciting, and that is going to be a resource that your institution can potentially adopt. Then we'll get into a suicide prevention app that we actually funded as well. And I believe that the Ohio Program for Campus Safety and Mental Health also actually initially funded the creation of this app, and then OSPF funded the continuation of it. And then we'll get into some other training opportunities that OSPF can offer your institution, whether that be for your students or your faculty and staff. And then at the end, like I mentioned, there will be time for open discussion. I know that you can't unmute yourself, but that's totally fine. Again, we can use that chat box or that Q&A box as well. All right, so I want to start off by talking about the history of the suicide prevention plan for Ohio and what makes it actually unique. So back in 2018, our staff at the Ohio Suicide Prevention Foundation attended a conference in Denver, the American Association of Suicidology annual conference. And we attended a workshop by the Suicide Prevention Resource Center that talked about state suicide prevention plans. And we quickly learned that Ohio was actually the last state to have a suicide prevention plan. We didn't have one. We've never had one. And all 49 states, other states, actually had a suicide prevention plan. So obviously that was a little bit of an embarrassment for Ohio, right? So what we decided to do is we decided to gather a diverse group of stakeholders across Ohio. And I have a list here of who we actually gathered. We wanted to sit down and we wanted to actually create this plan, and we wanted it to be multi-sectoral as well. We didn't want to just include government agencies, right? We have, if you look at the list here, we have government agencies, we have higher education. We consulted with the University of Cincinnati, of course. There's Nationwide Children's Hospital, right? We have public, private, nonprofit, government. Primary One Health. Of course, if you do look at the government agencies here, you will see the Ohio Department of Mental Health and Addiction Services, the Ohio Department of Health, the Ohio Department of Aging, the Ohio Department of Education, and the Department of Veterans Services as well. And again, we wanted a very diverse group of individuals. We had about a 30 group team that we put together, and we met over the course of about 6 months. And we came up with a plan, a 3-year plan to be implemented January 1st through January 1st, 2020 through December 31st, 2022. And backtrack just a little bit here. Here's again a picture of that press conference of some of the planning members with Governor DeWine. We had a press conference at the university, the Children's Hospital in Dayton, where we actually released the plan. So it was officially released February 28th of this year. So I think this might have been one of the last in-person events before COVID hit for many individuals in this picture here. So now that we've created this plan, where are we at now? We are in the implementation stage, right? So what we have learned about some other states, and I won't pick on anybody in particular, but what we've learned is some states have created a suicide prevention plan and it just became a pretty document that sat on somebody's desk. Whether that be because it was the person who oversees the implementation of that plan kind of sits like 6 levels down in administration, and they actually don't have any pull to get things done, or whether that be the lack of funding, the lack of accountability. So we wanted to make sure that we, we had that funding secured. We want to make sure that we have that accountability for our partners. So the next step was to create an implementation team. So some members from the initial writing team of that state plan are on this implementation team, but we have actually invited a few other members who were not on that writing team to be on the implementation team. Actually, Jessica is also a member of that implementation team, and we're very happy to have her represent the Ohio Program for Campus Safety and Mental Health as well. So the implementation team will actually ensure that the plan is being used across the state and all goals and objectives are addressed. And also, I want to emphasize, this is not the Ohio Suicide Prevention Foundation's plan, right? We just facilitated the creation of the plan. This is the state of Ohio's plan, right? This is everybody's plan. Every individual in the state can play a role in implementing the plan, whether that be just a general community member. Of course, you all as well involved with higher education. We have specifically called you out in the plan and how you can play a role. But the team actually is creating measures to track the progress of the plan. And based on these measures, we want to create a report card, if you will, for the state of Ohio. So how are we actually doing with our suicide rates and actually implementation of this plan? Are we a C? Are we a B? Are we an A? Right? And how are we going to compare that to other states as well? And to hold ourselves accountable, we are actually, again, still in contact with the governor's office, and we are going to create annual reports to the governor on the progress of the plan. And this document is actually a living document, right? So before, we didn't know COVID was going to happen as we designed this plan. It was right before COVID hit. And with that being said, this, we wanted to make sure that there were opportunities to actually change the plan if things came up, such as COVID. So that's a perfect example. So how do we actually adapt this plan? Because it's a 3-year plan, and as we know, there are many new resources and innovations that come out all the time. So as new resources come out and new evidence-based best practices emerge, how do we actually change the state plan to address that? And of course, after this 3-year plan, we are going to, again, sit down and write another 3-year plan based on lessons learned, what worked, what did not work, and things like that. And of course, this plan is being evaluated by a third party as well. We are evaluating internally our progress, but also a third party evaluator as well to make sure that we are staying on track. So, just kind of briefly, I do want to go over kind of our vision for the state plan, our mission statements, some intended outcomes, and then we'll get into kind of those strategies. We've identified 5 key strategies that are guiding the actual implementation of this plan. And these key strategies are, what the writing team identified as the 5 groups, individuals, or areas that we think are the most pressing or the most at risk at this moment to address. But starting with our vision statement, the writing team actually came up with, Ohio will actually reduce the number of suicides every year until not one life is lost. And that's a very powerful vision statement. We know it's very aspirational. We know we will never get to 0 suicides, right? But of course, that is the goal ultimately, is 0 suicides. So, again, until not one life is lost. So what are those intended outcomes, right, that we would like to see by the end of this 3-year plan? And we came up with, number one, reduction in suicidality is the obvious intended outcome. We want to see fewer suicides in the state, right? We want to see that this plan, there's a correlation that this plan has actually reduced number of suicide deaths and also reduced the suicide rate in Ohio by addressing key high-risk groups. Fewer number of suicides, a decrease by 10% over the 3 years. That's also a very aspirational goal, right? But we kind of wanted to shoot pretty high here, right? I mean, the suicide rates and the suicide numbers, as we know, are just increasing every single year for the most part. And we want to make a difference. Fewer number of attempted suicides as well, not just those that die by suicide, because we do know just because somebody doesn't die by their own hand doesn't mean that they're not living with pain and suffering every single day, right? And we want to give those individuals respect, and we want to serve those individuals as well. And improved identification of those thinking about suicide, because you're at risk if you're thinking about suicide. If you're not thinking about suicide, you're not at risk, right? So improved identification of those that are thinking of suicide. So we also came up with a list of core assumptions to what our group believed, again, are the core assumptions about suicide prevention. So I'll just quickly kind of go through this list here. Suicide is a preventable public health issue, and Ohio will work together to prevent suicide. We will implement that universal selected and indicated prevention as part of a comprehensive approach. So using that public health model, we also took into account the national strategy for suicide prevention as well. We wanted to include that. Focus on those with elevated risk factors first and foremost. We, of course, we can't list all groups and all demographics with elevated risk factors because we need to hyper focus on those that are at most risk first, and then we can move down to the other groups and the other individuals that are also at an elevated risk. We want to identify and address barriers to competent suicide care, ensure suicide care is accessible and effective. As we know, there are many barriers to those seeking care and seeking help. And we also want to promote postvention as a vital part of suicide prevention. So I appreciate Jessica for mentioning postvention at the beginning here. So we will touch on postvention because we do know that postvention is a form of prevention. Interventions and approaches will be data-driven and research-driven and culturally appropriate. We always want to use evidence-based or those emerging best practices as well, right? We want to emphasize what works. Ohio will increase public awareness about suicide and provide tools for responding effectively, strengthen the knowledge and skills of Ohio's workforce in identifying individuals at risk for suicide and intervening. So not just those that are working in the behavioral health or the healthcare realm, but also, again, those gatekeeper trainings for just everyday community members on identifying risk factors and responding and referring appropriately. We also know that substantial resources are necessary for a sustained effort to effectively decrease the suicide rate. We know that this 3-year plan is not going to be enough. We know that we're going to continuously have a living plan out there. Stigma reduction through culture change will make a positive impact on suicide prevention. We all know that the stigma is very alive and well to this day. Of course, we're always trying to fight that stigma, and we will continue to do so. Suicide prevention and postvention efforts must be evaluated. So this is where the evaluation piece comes into effect for efficacy, impact, and continuous improvement through accurate data collection analysis. So we will be relying on not just the Ohio Department of Health, but relying on local data as well. Everything's going to be data driven, and all efforts will be considered through a health equity lens. So before we move on from the state plan here, I do want to go over the 5 key strategies that I talked about. So these are kind of the high level strategies that are guiding all of the goals and the very specific goals and objectives and the action plans for the state plan. So I'll just go through the 5 strategies here, and then we'll hyper focus in on strategy 2, which is actually where the higher education system lies. And I'll go through specifically more some of those goals and objectives, and of course, how you all can play a role in implementing that portion of the state plan. So strategy 1 is all Ohioans will recognize the warning signs and risk factors of suicide and respond appropriately. So this strategy really is about campaigns, right? And also offering gatekeeper trainings as well. So it's just about that education piece, right? And that promotion piece. How can we ensure that more Ohioans recognize those warning signs and know how to respond, and of course, refer to those behavioral health professionals? Because as we know, oftentimes the first gatekeeper is somebody who's close, a loved one, a family member, or a friend that somebody will go to who might be suicidal. They'll go there before they actually go to a behavioral health professional. So it only makes sense that we increase the education out there and the availability of those gatekeeper trainings. So strategy 2. So again, this is where higher ed kind of lies in our plan. So Ohio will concentrate efforts on integrating suicide prevention practices and suicide care, including postvention, into high impact systems, including healthcare, public safety, and education. So education, K-12, and also higher ed as well. So this strategy is definitely one of the more involved strategies in the state plan. Yeah, it's all about systems change, and we know that that is a very difficult task, but we know that it's manageable if we all work together, and we all collectively work together to change those systems in the stigma and offer best practices to these systems, right? So that's where that's where we're going to start. But again, I'm going to go through all 5 of these strategies, and then I'll go back to strategy 2 and then go into the higher ed goals and how you can play a role. Strategy 3, Ohio will build suicide prevention capacity and infrastructure at the organizational, local, and state levels. So actually, higher ed plays a role in not just strategy 2, but it plays a role in almost all of the strategies. Again, how do we build that infrastructure and capacity, at the campus level, right? But also, how do we build the local resources around the campuses as well, right? Of course, we have goals and objectives and action plans of how we're actually going to try to do that. Strategy 4, so Ohio will concentrate prevention efforts on groups that current data has identified as being high risk for. So again, like I had mentioned, that we cannot list and focus on every single group or demographic that has experienced elevated risk for suicide or elevated rates for suicide. Where we want to start are those that the data has identified, the current data has identified at the very highest risk at the moment, right? We're not forgetting about any groups, right? If you look at this list here, you notice that individuals who identify in the LGBTQ population are not listed. That does not mean we're not addressing it. If you actually look through the state plan, it does mention individuals that are in the LGBTQ population, as well as, there's a lot of data out there right now about African-American suicides in Ohio. And of course, we, backtracking to strategy 1, which is about campaigns, we actually are working right now on a suicide in the Black community campaign across Ohio. So again, we're not forgetting any groups here. The ones listed here are just the groups that are at the very highest risk. I do see a question in the chat box.
I was going to say, Austin, there's a question that came in, if you want to go ahead and address that.
Sure. So Emily, I'm going to ask the uncomfortable question. Have we gotten any information about funds that will support this gigantic initiative? When will we talk about building infrastructures, trainings, etc.? It's not just a time invest. We are starting to really talk about dollars. Emily, very good question. Yes, funding. Yes, we do have funding. The Ohio Department of Mental Health and Addiction Services has given us funding for some of the initiatives in the state plan. However, we are not the Ohio Suicide Prevention Foundation. Again, like I mentioned, this is not just our plan, but also we're working with other organizations and nonprofits that also receive their individual funding for suicide prevention activities. But how do we actually, again, rope all of those organizations in to address what the state plan outlines? So yes, there's absolutely funding. We're continuously working on securing other funding as well. And of course, at the Ohio Suicide Prevention Foundation, everything that we're doing right now is kind of our Bible right now, the state plan. Everything we're doing is being guided by this state plan. So again, the strategy 4 here, I mean, the data has identified youth ages 10 to 24. The Ohio Department of Health last year came out with a report, 10-year report that saw a 56% increase in suicides in that youth 10 to 24, and that's exactly the age range that most of you individuals are working with, the primary population, the college campuses. And of course, we know that men are at higher risk for suicide. Veterans and military members, residents of Appalachian counties or other rural high-risk counties. So what you see on the map here is a map of Ohio looking back at the past 10 years, average suicide rates. So the darker the green county, the higher the suicide rates. So we can clearly see the highest concentration of counties with those highest suicide rates are in southern Appalachian counties for the most part. Again, there are a lot of risk factors involved there, but that is one of those high risk groups that we're focusing on. Now,
and Austin, this is Jessica. I just had a quick question. Did you say that this map was compiled based on data you said 2 years ago? Is that how it was compiled? 10 years ago.
10, yeah. So this study came out of the Ohio Innovation for Population Health in collaboration with Ohio University. So this report came out last year, but it's a 10-year report. So the average suicide rates in the past 10 years.
So then will it be at the end of the 3 years that we can expect for this map then to be updated?
We would like to see that happen,
Okay.
Of course. That is the ultimate goal. Of course, we didn't actually create this map here. So yes, we will be creating our own graphics. And again, we have a third-party evaluator that we are utilizing as well to evaluate our efforts and the impact. So yes, there will likely be a map that looks just like this, just with, again, updated numbers. We'd like to see that green go to a lighter shades of green. All right, so strategy 5, which is the last strategy here. This is, again, just all about evaluation and continuously informing our our approach. And we're going to rely heavily on data that comes out in real time to, again, address those high-risk groups. Are there other innovations out there? What is working? What is not working? We are constantly evaluating. And of course, COVID-19 has, obviously thrown kind of a wrench into our plans, but we have adapted specifically with virtual options, virtual trainings, virtual resources as well. But again, COVID's a perfect example of how extenuating circumstances can change the course of this state plan. All right, so back to strategy 2, like I had mentioned. So this is the strategy that specifically calls out the education system. So and higher ed is obviously a part of that. So what I'm going to do is I'm going to go over what we've worked on in the first year with some of the key goals and objectives of this strategy 2. So goal 2, objective 1, promote the adoption of core education and training guidelines regarding suicide prevention into the higher education curricula of health professions. So at the very beginning, during the agenda, on the agenda slide, I had mentioned that the Ohio Suicide Prevention Foundation has funded the creation and implementation of a semester-long suicide prevention course for, and it's an interprofessional course, an interdisciplinary course as well. And that course has been finalized, it's been evaluated, So we want to promote that course, and we want to offer it for free to any college and institute, any college of higher education and institution of higher education in Ohio for free to adopt in its entirety. We do not want to charge anybody for it. We just want that curriculum to get out there. We want other colleges to adopt it. Now, I understand that there are likely many barriers and challenges to actually adopting this course, but we want to make it as easy as possible for you all. I do have more information on that course and a couple more slides, but you'll have access to all of the materials that have been created, all the materials that have been evaluated as well. There's been a research article on the course, all of the lectures, all of the quizzes, all the exams, all of the sample projects. There's a course user manual for institutions on how do we actually adopt this course, and then also it goes into a sample syllabus, and we have this user manual to make it as easy as possible to adopt, because again, the objective here is just to get that course out there. So our performance measure is that Ohio institutions of higher ed will adopt the suicide prevention care, the course, into their curriculums by the end of the plan, which is December 31st, 2022. We don't have a specific number of colleges, but again, we would like to see some, and absolutely, I'm really glad to be talking about this in front of this audience today. It's kind of the first time that I'm talking about this in front of a higher education audience, because we are currently working on that marketing plan. We're going to have a specific page on our website with all of the information on that. That will be actually completed by the end of this month, and I would love to get that information out to you all. So where are we at now with actually implementing this this goal within the state plan? So again, I mentioned we're finalizing that marketing plan, and the next step is to disseminate a survey that Jessica will be sending out to you all as well, on higher education suicide prevention activities in Ohio. So Jessica had mentioned House Bill 28. So we know that public institutions in Ohio are required to have certain suicide prevention resources on campus and activities on campus. And, again, that just applies to those public institutions, but what are other institutions across the state doing as well, right? What specific trainings are you offering? What advocacy activities are you actually participating in? Are there student-led advocacy groups? How are you actually promoting your suicide prevention resources? How are you getting the word out? So again, we would love if you could participate in this survey. It would not take too long, but this is really what's going to guide years 2 and 3 of the state plan in terms of higher education. We're going to, the ultimate goal here really is to work with our work group based on these survey results. Okay, this is what other institutions in Ohio are doing. This is what they wish they had. How could OSPF and the suicide prevention plan be a resource to you all? What are your needs? What are your barriers? What are you already offering? We're going to compile that, and we're going to then, in years 2 and 3, use that information to kind of develop a best practice or a strategy that outlines what everybody has said who's participating in the survey. What strategies can we outline, and what resources can we offer? This will also guide OSPF as well. So what higher ed resources are you all asking for? We will then gear kind of some of our funding towards providing those resources for you all. So that is our next step, is to get that survey out there. OSPF has worked again with the Ohio program for campus safety and mental health as well on the creation of this survey. So one of the other goals of the higher ed system, kind of sub-goal within this strategy, is to promote core education and training guidelines and suicide prevention best practices for professional licensing boards and related entities. Because, as we know, behavioral health professionals, counselors, therapists, social workers, most of the time do not get formal education while they are going to school to get their degrees, or when they're going to get their license, on how do you actually treat somebody effectively who is suicidal. How do you do that? And as we know, these are the professionals that individuals who are suicidal are going to. So we want to supplement the best we can with workforce development trainings, but professional licensing boards in Ohio, as they stand right now, are not requiring specific suicide prevention hours. So really what we're trying to do is we are trying to advocate to those prevention boards. And also, you know, the Ohio Psychological Association board, social worker, marriage, family counselor board as well, on actually how do we promote suicide prevention hours. And the ultimate goal really is to, you know, potentially get a mandate for some suicide prevention hours. We know that's a difficult task, but that is where we are at right now, so that those individuals in the workforce are adequately prepared and competent and confident in treating suicidal clients. And of course, that is also why we funded the development of that interprofessional suicide prevention course as well, right? So that we can actually get some formal education for students while they're in school. I do want to talk about that interprofessional suicide prevention course. We are very excited about it, and I hope that you all are intrigued by this idea and this resource for you all. So I had already mentioned that, you know, behavioral health professionals often do not get that specific suicide prevention and treatment education while in school. So that is kind of what sparked us to fund out of the University of Cincinnati and Old Dominion University at the time, but then then we also included the University of North Carolina at Charlotte to actually, again, develop this suicide prevention course. It's based on the interprofessional education model, which a lot of research has backed. And we funded this through our SAMHSA GLS grant. Jessica, at the beginning, I mentioned that one of my roles is to oversee that grant, all the programming involved with it. That grant actually ended September 30th of this year, but this course will live on indefinitely. And again, that's one sustainable product of this grant that we have created and implemented, and we're really excited about it. And this course, when it was being evaluated and implemented at all three of these institutions that I mentioned, it was offered all in person. It was also offered blended, and it was also offered all online. So again, a research article was created looking at all three modalities here, and all three yielded similar results. The in-person, as no surprise to anybody, probably is most preferred for students, but of course online was effective as well, and the blended model. And the course user manual that we do have addresses, again, how do you actually implement all in person? How do you incorporate those materials in the blended and all online formats as well? So what types of institutions can adopt this course? Honestly, any college or any institution of higher education. Public four-year universities, private not-for-profit, private for-profit, and community colleges, as well as technical colleges and trade schools as well, can actually adopt this course. So you're probably asking what types of students can benefit. Actually, both undergraduate and graduate level students. So when these courses were offered at UC, at UNCC, and at Old Dominion University, it was blended. It was high level undergraduate students and graduate students as well, who are in the help giving professions, and that's very vague, and it's meant to be very vague. A lot of a lot of the competencies in this course are very applicable to many disciplines, many majors out there, many programs out there. So I do have a list here that's kind of been identified by our researchers that benefited the most. So health professions, again, both undergraduate and grad students. So those that are in the counseling programs, social work, public health, psychology, medicine, ethics, law, nursing, and also, again, other relevant disciplines as well. So just some overview of the major topics that are actually covered in this course. And again, I can't go through them all. We'd be talking about it for a pretty long time, but I'm happy to provide you all in that follow-up email too with the whole outline and the user manual for this course. But foundational competencies in suicide prevention. So really just a background of what suicide prevention is, who can play a role in suicide prevention, but then it also gets into, again, that public health model. So what are some community-based competencies? So that primary prevention and postvention at the high level, right? Those gatekeeper trainings and safe messaging and things like that. Then into secondary prevention, social, interpersonal, and at-risk competencies. And then it gets very individualized in that tertiary prevention for clinical and individual competencies. So again, that goes into things like assessment, developing a risk assessment for your clients or for those that you serve in your discipline. So some of those key findings, just quickly, regarding this course and its effectiveness. It demonstrated sizable gains in suicide prevention related efficacy and knowledge. Of course, we'd like to see that these students actually reported that they do feel more knowledgeable and competent in suicide prevention. But it also increased the perceived ability to help self-harming patients and clients. Suicide prevention knowledge and beliefs that persons dying by suicide possess characteristics consistent with depression and isolation. And participants expressed notably high intent to engage in best intervention and best practices, and draw on best available public health practices and participate in interprofessional teams. So students, again, are using and recognize the importance of using the most up-to-date and evidence-based practices. So I kind of already mentioned this, briefly go over this again, but institutions that are interested in adopting the course will get the syllabus, course user manual, all lecture PowerPoints, all quizzes and exams, and all sample projects, as well as potentially a chance to consult with the actual original implementers of this course. When this website page is launched by the end of this, at the end of this month, there's a video of where we interviewed the researchers and the professors of the original iteration of this course, and they talk about how they're open to consultation for interested universities, because of course I'm sure there are a bunch of questions that you all would have if you wanted to adopt. And again, who do we actually engage with on your campus, right? If you are interested, who are those right people? And OSPF would love to be a part of that conversation as well, if you do express interest.
Which will be my question, Austin, and I'm sure you're probably going to get to that next. If there's a specific campus that would want to know, hey, we have interest in implementing this course or bringing this course to a specific college or program at our university, would they contact you, or who would they contact at OSPF or University of Cincinnati to gain access to this course?
Sure. So it would begin contacting me, and I'll have my information at the end. I'm sure that Jessica, you'd send that out as well. But typically when we ask the implementers of this course and the developmenters of this course of which colleges would best be suited to actually house this program, there are various. I mean, whatever makes sense for your university, honestly, it's kind of a simple answer, but some examples: Department of Social Work, Public Health, Psychology, those would be good ones.
Okay. Next question that just came to mind, and I just want to encourage others, if you have questions not only about this course that Austin mentioned, but other questions about the Ohio Suicide Prevention Foundation, perhaps some trainings and other things that they offer, please feel free to go ahead and post your questions in the chat and/or question and answer function. But I just had another question. You mentioned that the suicide prevention course is a semester long. But we know now there's so many integrated models in terms of learning. And let's say it's a graduate program, would there potentially, or could there potentially be an opportunity for this to be offered even as an accelerated course? You may not know that right now, but maybe in terms of like a weekend workshop or maybe a condensed semester. Do you know if that's a possibility at all?
So at this time, it's really, like I said, this is a relatively new course, right? I mean, there has been research, like I had mentioned, over the past 4 years of this course being implemented that demonstrates its effectiveness. But that research and the initial course has only been evaluated for that semester-long version. With that being said, like I had mentioned, there might be the opportunity to consult with the actual creators of this program, right? And again, that conversation would begin with me, and then I would connect you with those individuals at the various institutions that I mentioned. But like I had said, as it is, it's the semester-long course. Now, the researchers, they might have other opinions. They might have, they might be able to offer a better explanation, and they might be a better resource to talk to about that condensed version that you had mentioned, or
Sure.
weekend courses.
Certainly, certainly. And so there's a question that has presented, and it is, has there been a thought given to higher level university contact beyond the mental health services? Meaning, we know faculty and staff have high amounts of contact. Are we thinking about how to engage with them as a whole and support through their organizations?
Yes. So actually, yes, we do have a couple of resources actually that, hopefully I understand your question, Emily. How do we ensure that there's that connection between students and faculty in terms of suicide prevention and kind of that help seeking, help giving atmosphere or culture? Is that, I hope that's what you are getting at. If so, a couple of resources I want to talk about here at the end is that OSPF and Lakeland Community College over the past 5 years have actually worked together to offer a suicide prevention app for students, but not only just students, but for faculty and staff as well. The app, we have about 15 institutions across Ohio that have actually customized this app. And what I mean customized is not just aesthetically, right? You'll have your logo on it, your colors, you picture your campus in the background, but also what are those campus level resources that are available for students, for faculty and staff, right? The contacts, things like that, but also the local resources that are surrounding that campus as well. And, information on how to help yourself, how to help others, campus and local resources, and those suicide warning signs. And here you kind of see, I have a screenshot of the Lakeland's app, the How to Help a Friend button on there, the do's and don'ts, there's hope videos, testimonials, risk factors, where to get help, and things like that. But that's just one of the resources. And I mentioned this, like I had said, that this SAMHSA GLS grant ended at the end of September. With that being said, though, how can your campus, if you're interested, actually adopt this app? It's relatively cheap. Price is negotiable, and when I say cheap, I mean under $5,000, potentially lower than that, to actually the whole process. They'll customize the app at Lakeland and they'll tweak it for you. But with that being said, our initial funding, because we offered it for free for campuses across Ohio, but that funding has ended. However, Lakeland Community College is still interested in contracting with other interested institutions. You would fill out an application process that involves working with your IT department, working with your marketing department, and also your counseling department or student services department on actually gathering those resources for behavioral health on your campus. And again, I would be the first line of contact to connect you if you are interested in that. But back here, this is just some examples. This is not all 15, but just some examples of the institutions across Ohio that have already adopted the app. As you can see, they're, not just public institutions, but we have private as well. We have community colleges, Columbus State, Cuyahoga Community College, University of Cincinnati, so a larger university. We also Otterbein University, Stark State, Case Western. It's a very diverse group.
And so there is a follow-up comment too from Emily stating that this is good to know, that mental health at college and university campuses need to be recognized as a system within a system, which, of course, adds complication for other opportunities. I actually have another question because I know in your introduction, you talked about there being coalition, and I know that the Ohio Suicide Prevention Foundation does some work around the state with suicide prevention coalitions. And so if there is, let's say, a student, staff, and faculty that has interest in getting involved in suicide prevention efforts within their local community, how can they get involved in coalition work? Who would they contact to get involved?
Yeah, that's a great question. Thank you. So on our website, ohiospf.org, I can put that in the chat box as well. But on our homepage, we have a map of Ohio broken down by county. When you click a county, not all counties in Ohio have a local suicide prevention coalition. Most do. I think it's a little over 80 of the 88 counties that have a local suicide prevention coalition. A little disclaimer, some coalitions are more developed than others and have more funding behind them from local resources, local funding sources. But there are, again, about 80 of the 88 counties do have a coalition of some level. And you can actually, again, click on that county. So say, again, you're in Cleveland, right? You go to Cleveland State University and click on Cuyahoga County. There's the Cuyahoga County Coalition information right there. And you can contact that that individual that oversees that coalition. There's typically a phone number and an email address there as well. There I just put in ohiospf.org as our website.
All right, very good, very good. So Austin, I really thank you for the presentation today. I'll check one more time to see if we have any other questions that have presented, and don't see any other questions or comments. But again, I want to thank you for a very informative presentation today regarding Ohio's new suicide prevention plan. It was certainly helpful for me to understand more in the development of that plan, who all was at the table, and the relevancy of higher education to that plan, specific for strategy too, okay? And so as a follow-up, we know that there will be information disseminated on the Ohio Program for Campus Safety and Mental Health listserv for the survey that you all are looking to gather information. I think it actually would be really beneficial for, not only for Ohio Suicide Prevention Foundation, but even the work that we do here at Ohio Program for Campus Safety and Mental Health, to know what programs are being offered, what activities and trainings and whatnot are being offered. So I think it'd be beneficial really for everyone to know that information.
And this might be a valuable resource for you all, is OSPF has just received kind of a significant amount of funding to offer QPR trainings across the state by the end of December of this year. And with that being said, if you all are interested, whether that be a group of students or whether that be a group of faculty and staff or even RAs, want to receive a free QPR training, we can offer those virtually or in person. So again, if you are interested, we will offer that for free, and I invite you to contact me with that direct request if you are interested, and we can get something lined up for you all. And with that being said, Jessica, can we actually have that in the follow-up as well? Just
all right. Certainly, and that's very good to know. And so I'll reiterate that point. So the Ohio Suicide Prevention Foundation is able to offer a free virtual QPR training throughout the end of this year, correct?
Correct. Yes, and potentially after December, but this initial funding is through the end of this year.
Okay, so that information we will also disseminate when we send out the PowerPoint slides. And actually looks like there is a question. It says, where can we get training to teach QPR?
So to become a trainer, you have to go through the QPR Institute.
And so we thank you again, Austin, for your time. We thank you for Ohio Suicide Prevention Foundation presenting this very, very vital information, and have a great afternoon.
Thank you so much.
Thank you again, everyone.